Hey everybody, I'm Casper.
And I'm David, and we were two sweaty guys who started Carpe.
We met in college, we connected over our sweaty hands, and we've spent the past few years thinking about sweat, researching sweat, and working on sweat solutions.
So join us each week, and let's talk about sweat.
And hello everybody, thank you for joining us tonight. We're David and Casper here, the co-founders of Carpe, and we're joined tonight by Dr. Ashish Bhatia. He is the Chief Medical Advisor here at Carpe, as well as an Associate Professor of Dermatology at Northwestern University and the Director of Dermatology at Oak Dermatology, which is in the suburbs of Chicago. He's a huge name in the hyperhidrosis space, has done a lot of research here over the years, and he's been incredible in teaching us a lot of what we know about hyperhidrosis. And tonight we thought would be an excellent opportunity for him to answer your questions about excessive sweating. So hello, Dr. Bhatia. Thank you for joining us.
Hello. Thanks for having me, guys. Great to see you.
Awesome. So again, if you have any questions, we're going to start going through questions that were submitted previously by everyone. If you have new questions, please don't hesitate. If you just logged on, you can just go to the question tab, the Q&A tab, and submit your question there. Awesome. So let's dive in. First question that we got from Carpe customers. Can excessive sweating be passed down from parent to child?
Yeah, that's a good question. Absolutely. We see that a lot, that where it runs in families. So sometimes it skips a generation, but often, a parent might have some hyperhidrosis and the child might too. Now, this isn't always the case. Obviously, there's plenty of situations where, and I think most situations, it's kind of a sporadic where, one person in a family might have it and none of their siblings have it and none of their parents have it. So it really varies, but it can be passed down, and sometimes we definitely see it, especially when people have sweating kind of all over. That might be more of a family trait you end up seeing passed down, so could be hereditary.
Great, thank you. So second question that we got, will using will using products to stop sweat in one body part make other areas more sweaty?
Yeah, so there's a name for that. We call that compensatory hyperhidrosis, and that's when if you stop sweating in one area, it starts sweating in a new area. It's extremely rare, but it does happen. But we don't really see it with antiperspirants or even with Botox used for blocking sweat. It's really the most it's reported is when people have a surgical procedure to stop their sweating called sympathectomy, where they actually go into the chest. So what they do is you put you under, they drop a lung, kind of go in through the armpit, and with a laparoscope, they find the nerves that actually activate the sweat glands in your hands, isolate those, and actually clip those off. And as you can imagine, when you're dropping lungs and stuff, it's not a simple, easy procedure, but in some people it is very effective. And where I've seen compensatory hyperhidrosis is in some of those patients where, they get relief from sweating in their hands, but then they start scalp sweating or face sweating. And so, and even in that, I think it's probably less than 5% of people get that situation, but it can happen. So it's good to know about it and know what all the possibilities are before going in for a procedure like that.
Great, thank you. And is there any predictor for where that compensatory sweating will occur?
It can be anywhere. So that's the strange thing. We've seen it where, like I said, it's on the scalp or on the face or sometimes on the feet or just on various parts of the trunk. So there is no way to really predict where somebody's going to get the compensatory hyperhidrosis.
Okay, very interesting. Thank you. So let's dive into the third question that we got. This is an interesting one. So a question from a postmenopausal woman, Jane. She thought she'd be done with night sweats and daily face head sweat on the other side of menopause. She's still sweating a lot. Is it still hormonal at this point or something else?
That is something that always needs to be investigated. So, a lot of people report sweating when they're going through their hot flashes. And if they didn't have sweating prior to the perimenopausal time, then most of the time we assume that it is related to their changes in hormone and hormone fluctuations. But if they continue to have sweating even after they're kind of done with menopause, it doesn't mean it's not related to the menopause, because really some of the symptoms that you have with menopause is due to fluctuations in your hormonal levels. And so it really needs to be investigated. I think somebody like that really needs to actually be checked out by their gynecologist or an endocrinologist, and to do a thorough investigation to make sure it isn't something still going on with their hormones. And if it's not, then it's just hyperhidrosis at that point, primary hyperhidrosis. And then either way, you can use topicals to help control it, but you want to make sure everything's normal with your hormone levels, and that you've kind of successfully made it through menopause and are in a good place. Because if you're not, then you should get investigated to make sure there's not something else going on.
Okay,
Makes sense.
This next one, I think, relates to a lot of people who are really stressed by their sweat and are really impacted by it. The question is there a correlation between hyperhidrosis, excessive sweat, and overall emotional well-being?
Yeah, absolutely. The thing with hyperhidrosis, of all the dermatologic conditions that we deal with, if you look at it, it's really been rated as one of the ones that has the highest impact on a person's quality of life. And you can think we deal with some pretty tough diseases for people to deal with, psoriasis and eczema and things like that. But surprisingly, and not surprisingly, hyperhidrosis is really, really impactful. And I think that's why guys like you are kind of there to try to help out, because you understand how much of an impact it plays on people's lives, and being able to provide a solution that's simple to use and convenient and affordable and accessible is really, really key because of how much it affects people's lives. And I didn't really realize it until I started seeing patients in practice, right? And it affects kind of the gamut of people. I mean, it's not one particular socioeconomic class. It's not one particular age group. You see kids impacted by it tremendously, right? Imagine you've got sweaty hands and you can't hold hands, or play in gym class once COVID's over, and all these things, right? So the social interactions that deal with touch, social interactions that deal with not having sweat going through your coat, these things really play an impact on people's lives, right? And if you can't do those basic things, then that definitely increases stress and decreases your emotional well-being. So, it's been one of the things that I think has been so impactful to see, and it's one of the most rewarding things to treat, because as a physician, when you can alleviate that stress for people by taking care of their hyperhidrosis and making them feel quote unquote normal again, it's really rewarding. So, I think it does affect people's well-being. So, and like I said, whether it's an adult or a child, in adults, we see it a lot with people just ruining their clothes, and it could be an executive that goes through suits like crazy, or, somebody, I'll tell you, in physicians, it really plays a big role. So, I had a couple of colleagues in med school that had hyperhidrosis, and imagine primary hyperhidrosis and you want to be a surgeon.
Yeah.
And your gloves start filling with fluid, so you really can't operate like that. And so, being able to treat that, get that under control, really kind of gives them their livelihood back. So absolutely, it definitely affects quality of life and stress.
So speaking of those specific examples, one thing that I've been struck by in speaking with so many people with hyperhidrosis is, they often have a particular area that it really bothers them the most. And they're really suffering because of it. I was just wondering if you've ever noticed any patterns of that. Where is it most common? Where do people seem to have the most severe issues with excessive sweating?
Yeah, so what we see in practice is primarily 3 areas, or 4 areas actually. The palms we talked about, the feet, and people have come in showing me their shoes that have like a salt sweat line along the base of shoes, and they tell me they ruin shoes every every couple of months, 2-3 months, they have to go through new pairs of shoes, can't wear sandals, all that kind of stuff. The other place is on the face. And that's really troubling because, when you start sweating on your face, it's visible, right, to everybody that sees you. And you may not even be nervous and you just start sweating and people can mistake that and for a lot of different emotional states. So that's an issue. And then, obviously axillary, which is the armpits, because that ends up ruining a lot of clothes. So those are really the most common places we see it and we hear about it. But, just today a patient was referred to me for scalp hyperhidrosis. And you wouldn't think that that's really a thing, but it is. And this person is going to be coming in for evaluation. Actually, it was another physician that contacted me and said, I have a patient and he has scalp hyperhidrosis and it drips down his face, from his scalp, and it's really troubling. And so, are there solutions that you can offer for that? And we said, yeah, absolutely, there are, and be happy to see him and see if we can help.
That's great. So, how are you going to treat that patient?
Interesting. So, with scalp hyperhidrosis, you got a couple options, right? You can use topical antiperspirants. That's one of the options you can use. Something that's more in a solution base that can easily get on the scalp without making the hair greasy. So that's one option. Another thing we do pretty commonly for scalp hyperhidrosis is Botox. So Botox is simply a botulinum toxin. And, Botox was the only brand on the market, but there's several now. There's 4 that are available commercially. And so we can inject those through the scalp, and they really work directly by blocking that signal from the sympathetic nervous system or parasympathetic nervous system to the actual eccrine glands and stimulating them to secrete sweat. So we can block that signal. It's temporary, but generally off the face, it tends to last anywhere from 4 to 6 months. So we can use that. The other option is like an oral drug. There's drugs called glycopyrrolate, and you can give that, and that can help actually block the sweating. But it affects your whole body because when you're taking it orally, all the systems are affected that are blocked there, and so you can get side effects from it, like urinary retention, dry mouth, trouble with focusing your vision. So there are some side effects. And so we try to avoid using things that have what we call systemic side effects, meaning side effects all over the body, and try to do things that are more locally active. So like I said, I think those are probably the 2 things. One of the other things we can use for it, it's off-label, but there's a drug called Qbrexza, which are wipes. They're a prescription wipe, and it's an anticholinergic. But you apply it topically, and it's approved for axillary hyperhidrosis. But you could theoretically take these wipes and put them on the scalp. But if this drips down or gets in the eye, then you can have trouble focusing and all those type of things too. So, but we're going to start with the simple things, and try to use a topical antiperspirant first. And then probably go on to the botulinum toxins. So
that's an incredible therapeutic ladder to learn about. For everybody just joining us, wanted to say hello. We're David and Casper, co-founders of Carpe, joined today by Dr. Ashish Bhatia, a leading dermatologist in the sweat world, in the world of excessive sweating, who's joining us tonight to answer some questions. So if you have any questions for Dr. Bhatia, any questions about sweating, about hyperhidrosis, please just click that Q&A button at the bottom of your screen. Send us your questions, and we'll be reading them out to Dr. Bhatia, along with questions that we received before tonight for tonight's session. So, David, speaking of, what is the next question we've got on our list?
Yeah, so a lot of people wonder why on the drug facts label of antiperspirants, it says, ask a doctor if you have kidney disease. This next question kind of gets at that overall thought that a lot of us have about why that's there. So the question is, antiperspirants say, ask a doctor before use if you have kidney disease. Mm-hmm. One of my kidneys was removed. Should I not use antiperspirants?
Yeah, so that's very interesting, right? So if you look at antiperspirants, topically applied antiperspirants, they're all salts, and they usually are some salts of aluminum. That's the most common salt that's in there. And so when you apply a topical antiperspirant, you're applying aluminum to your skin. And what was known in the past was that aluminum was used as part of the dialysis process. So if somebody had kidney disease, they would give them aluminum. And dialysis doesn't really get rid of it. And when your kidneys aren't functioning well, you don't get rid of the aluminum well either. And so it accumulated in the body, and there were cases of dementia that occurred with it. The reality is, when you apply a topical salt like this, like any antiperspirant, the aluminum does not get absorbed in the body. And so it's kind of a holdover from the old days that they knew about this. They don't really use aluminum at all in dialysis anymore either. So it's really a non-issue. If you're concerned about it, if you have very poor kidney function, you may want to ask your nephrologist before you use something. But odds are they're going to tell you it's safe to use, because you really have to absorb it, and it has to accumulate in the body in a significant amount before it can cause any problem. So yeah, just one of those little holdovers from the past. A lot of drugs, and really these are drugs, right? These are over-the-counter drugs that we're using, but they're still drugs. A lot of these drugs have a lot of historical packaging, and even aspirin has that, right? If you read the disclaimer on aspirin, you would never use it. So it's terrifying. So, and I honestly, I don't think it would get through the FDA today. Just because it has so many side effects. But that's how things are. But I think in most cases it's very safe to use topical antiperspirants.
That's a fascinating dive. I've never really heard so much detail about that issue. So this next one, kind of also a very, very particular question. I'm just going to read the full question here. Why do my hands turn red in addition to pulmonary hyperhidrosis? According to my research, it's because of my overactive sympathetic nervous system causes the blood vessels in my hands to vasoconstrict. If this is the case, how can I stop this redness? So kind of a multi-part question. Are they correct? Is this a sympathetic nervous system that's associated with the hyperhidrosis? How does that even work?
Yeah, the cholinergic signal that really goes out to the sweat glands, that cholinergic signal will also dilate blood vessels. And so that's why you get redness and engorging of the skin that's around these areas. It doesn't happen in everybody, but there are patients or people that get this problem. And, sometimes it's on the face, they get the flushing, sometimes it's on the hands. So it's difficult to deal with, because now you're red and you're sweaty, and it's calling attention to the area. And some of our patients even complain that it feels swollen. And they're not just imagining this. This is actually happening. They're getting kind of engorgement of the vessels in that area. And so, and then you also, the skin on the palms and soles especially is much thicker. And if it's constantly wet, it gets logged with fluid, right? It gets waterlogged because you have this thick layer of skin that's gets soft, and you even notice sometimes it gets white and kind of mushy. So all of these things can make hyperhidrosis very uncomfortable for somebody. And so one of the things you can do is use an anticholinergic, right? Because if you use that, it should block those signals and really take care of all the problems. Botox sometimes helps as well. And, oral or topical anticholinergics help as well. So, the topical antiperspirants will stop the sweating because they actually block the pores where the sweat comes out, but may not help with the engorgement. But I'll tell you, most people don't have that issue, the redness and engorgement. So most people are really well served with just a topical antiperspirant.
That's good to know.
Yeah.
So kind of following up on the second part of that question, are there any options if you do have that engorgement? What would you recommend if somebody comes in and says, like, I'm really, this flushing, it's really a pain point for me?
Yeah. So like I said, one of the things you could do is use one of the topical anticholinergics like Qbrexza and see if that helps, or use like Botox injections. That could help. Third option is the oral anticholinergics like glycopyrrolate. And, the other option you can do, especially if you don't have that engorgement, but you have a lot of redness, is you can use topical vasoconstrictors. And one of the ones that's approved and on the market now is called Rhofade, RHOFADE. And it's specifically for facial redness, but you can use it anywhere. and you apply it, what it does is it constricts the blood vessels. So, it takes care of the issue, but from a different angle. It won't do anything for the sweat. You'd still have to apply an antiperspirant, but you can decrease the redness and the flushing using this topical vasoconstrictor.
So that actually ties into a question that we just got from the audience. How intense can you sweat? Is it normal to sweat profusely in your palms, legs, and armpits?
We've seen everything. I mean, there's some patients that we've seen that have come in, they hold their hand up and sweat's literally dripping off of their hands in real time while we're watching it. And it's very dramatic and it's very sad because you can't do anything. When your hand's like constantly wet, you can't dry it. It can be so life-changing. Imagine you can't use your touchscreen on a cell phone or an iPad, right? You can't hold a book. You really can't do much. And so it can be quite extreme. And, kind of the definition of hyperhidrosis is when your sweating is affecting your quality of life. It's affecting your ability to do things or affecting how you feel. And so, when you get to that point, whether it be just a little bit, and for some people, that's a very little amount of sweat that makes them feel that way. For some people, it's this profuse sweating. And so I think as soon as it starts affecting your quality of life or your mental state, you should look into getting it treated because there's no reason not to anymore. We have so many options and so many of them are very accessible. We've talked about topical antiperspirants like Carpe and, what you guys have done. I think, what you've done is amazing. You've really created something for everybody that's accessible and easy to use. And I mean, it really should be kind of a first line. Why not try this? It's something that's affordable. It's available. You've kind of customized it for different parts of the body. And kudos to you for really, seeing something that really causes an impact in people's lives and addressing it. So that's awesome.
Well, thank you. That definitely means a lot to us. Kind of along the lines of what you were talking about, I really want to drill into this idea of normal. Is it normal to sweat profusely? I think what a lot of people mean when I ask that, and I don't want to speak for this particular person who's asking this question, but what I hear a lot is this dangerous? Does this mean there's something wrong with me that I'm sweating so much? Am I going to get hurt? Am I going to die because of this?
Yeah, great question. So, when we look at hyperhidrosis, medically speaking, we look at primary hyperhidrosis, which just happens and it's normal, or secondary hyperhidrosis. And secondary hyperhidrosis means it's being caused by some other medical reason that needs to be addressed. So, it could be an endocrine dysfunction. It could be a medication that you're taking. A lot of times it is medication. A lot of medications do have side effects of sweating. So, it could be related to hormonal dysfunction. So, that's why I think if you have sweating, and especially if you have a lot of other symptoms with it, you should definitely have a doctor evaluate that to make sure it's not secondary hyperhidrosis and there isn't something going on that's causing that. And if not, if it's truly just primary hyperhidrosis, then you've got the gamut of options from topicals and over-the-counters to prescription medications. So, and sometimes even a little bit of excessive sweating, if you see a change, right? Most of your life you haven't had issues with sweating, and then all of a sudden now you're having issues with sweating that are really affecting your life. Yeah, could it be anxiety? A lot of people just chalk it up to anxiety, but it might not be. It might be something else going on. There could be a adrenal gland tumor, called a pheochromocytoma that could have developed, and so you definitely want to get that checked and rule that out. So any changes in your life that cause this, or anything that's really out of whack, I think it's a good idea to always go see your primary care physician or dermatologist and get that evaluated. And once you've ruled that out, then you can kind of rest easy and then look at all the other options there.
Okay, so this is really interesting. I mean, somebody's coming in, your first line of thinking is you want to make sure that this isn't secondary hyperhidrosis. Is that accurate?
Yeah. And a lot of times you can tell that right away, right? If it's been going on all their lives and hasn't really worsened, but it's just affecting their state a little bit more, then usually we're not going to be doing a big workup. right? We just ask them some screening questions and move on. But if it's a sudden change or sudden increase in intensity, it makes us stop and think, right? And we ask get a good history, right? Get a good history and do a good physical exam and see if there's any signs of other things that could tie with it that could signal an issue, a medical problem.
But in most cases, I mean, do you find when it comes to sweating, it's primary or it's something serious?
It's the majority of people have primary hyperhidrosis. Yeah, it's pretty rare that we discover something, and it's one of those like kind of red herring days. You're like, okay, wow, I'm glad I caught that, but it's very uncommon. I can't say even in the last 6 months I've diagnosed a secondary hyperhidrosis. So the 90+% of people that come in have primary hyperhidrosis. That's
really reassuring. And what you're saying is when it's primary hyperhidrosis, it's not dangerous. You're saying you've got the gamut of treatments just to actually attack the sweating. There's nothing dangerous underlying the sweating.
Correct. Yeah, but it is affecting their life, so we're really worried about the fact that it's happening and what are we going to do about it, rather than, oh, it's happening and oh my gosh, there might be something else going on. So rest assured, that's pretty rare. But if there are sudden changes, you have a lot of other symptoms, heart racing, things like that, then it should be evaluated.
Good, thank you. So the next question is about the safety of aluminum salts. This has come up in the public, and it's a really good question. I'm excited that we're going to address it here. So the question is, does the aluminum in antiperspirants penetrate one's skin, causing aluminum toxicity?
Yeah.
And sorry, I just wanted to add, because this is probably irrelevant, I think, but they're asking specifically about the size of the molecules, whether that has anything to do with it. How does that all work?
Yeah, so, kind of going back to the question that was asked before about related to the kidneys, with both of these, it's a bit of a non-issue because, we measured blood levels of aluminum and after applying this, and it really just doesn't get through the skin. So, it's a negligible amount that could even get into the circulatory system. So it's really a non-issue. I think most of it, like I said, it goes back historically to when, aluminum was used with dialysis and caused dementia and caused issues. So, getting aluminum toxicity is from a topical is a non-issue. It's too big of a molecule to actually go in. So, and even the way, if you think about how topical antiperspirants work, the salt actually goes and actually plugs up the eccrine gland, and it prevents sweat from coming out of the eccrine gland. And the eccrine gland is the gland that's in the skin. It's more in the back of the hands and on the face and in certain areas. And that's what produces clear, watery, salty sweat. And, that's the only place it really affects. And so getting in there, it's really nearly impossible for it to get into the bloodstream from there. So it's a non-issue. It's not something I really worry about. And I tell my patients that it's really a non-issue. It's more of a myth.
That makes sense. I mean, that's all the research that we've done has also found. So let's see. Iontophoresis. This is a question we get a lot. Iontophoresis is a bit weird, right? Because you're kind of running an electrical current through your hands or through your feet. Is it dangerous? Are there side effects? I mean, should people be worried if they're getting into iontophoresis?
And Dr. Bhatia, before you explain kind of is iontophoresis safe or dangerous, could you just explain for everyone who doesn't know what iontophoresis is, what exactly it is and how it works?
Yeah, sure. Iontophoresis has been around for as long as I've been practicing it, well before then. And it's a treatment for hyperhidrosis that's been used for a long time. And you basically have these little pads or electrodes and a little sponge in there, and you put a solution in there, and then you run a current through that solution and put your hands in there or your feet. And what it does is it electrically actually helps plug up the little sweat glands and take care of it that way. Now, the two questions there was, well, first of all, it's uncomfortable. I'll tell you, it's not very comfortable. People don't like current running through their hands. So, and it does have to be repeated and be used consistently to get effect. But that being said, the first part of the question was, is it safe? Yeah, it's very safe. It's safe. It's easy to use, but it's uncomfortable to use, and it's a nuisance. And if you're traveling, you have to take this equipment with you. So there's definitely some downsides to it, but they're more practical downsides than anything to do with safety. The second part of it is, are there any side effects? So, what our patients end up seeing is some dryness, sometimes to the palms or soles or the area being treated. And you can definitely get some irritation too. So some people get a little bit of peeling or dryness or irritation. So those are really the only side effects I've ever seen with it. But for the people that use it, can tolerate it, and use it consistently, it is effective. But I'll tell you, in today's day and age of convenience, it's a pretty hard sell.
Yeah,
that makes sense.
So the next question is about something a lot more simple: food. We all love food. Yeah. Are there certain foods that cause you to sweat more?
That's an interesting question. So, we get questions about that with acne, with so many conditions, right? Does food affect things? And the answer is not a lot of great studies done to show or prove that it does. And the reason being is because it varies a lot from person to person. So what we've seen is in our patients, there are some patients that are definitely affected. Their hyperhidrosis is definitely affected by certain things that they eat or drink. And this is just historically from what they tell us, right? And many of these things are very similar to what we call the flare factors for rosacea, where, it might be red wine, it might be alcohol, it might be spicy foods. And if you think about it, right, spicy foods probably cause a lot of people to sweat anyways, even if you don't have hyperhidrosis.
Yeah.
So, so it could exacerbate it. So it's hard to say, but, I tell patients that, it varies person to person. And if you've noticed that there's a relationship between a food or a drink that you have and you get sweatier, then, you should try to avoid it if you want to avoid sweating. So, there is a relationship, but I think it just varies tremendously person to person.
What about sweating just when eating? I know that this is something that I've heard about where it's not tied to any particular food, but it's I believe it's called gustatory sweating.
That's correct. Yeah. And this happens. There's a few different conditions that occur that are gustatory. Gustatory means relating to digestion, right? So, so when you're chewing and you're salivating, when you chew food, there's a signal that goes to your salivary glands to help you make saliva, to help you, soften the food and swallow it. And the thought is that somehow the nerve signals kind of get mixed up, and you actually send the same signal to your sweat glands. And so at the same time as you're salivating, you start sweating in certain areas. And so it's a very real phenomenon. I've seen it once. So it's not very common, but it definitely happens. There's also like a gustatory rhinorrhea where there's some patients while they're eating, their nose starts running. And, they think it's just a little miswiring that's kind of happened, and you're activating sweat glands in one case, or, nasal secretions in another. So definitely a very real thing, and it's very unfortunate when it happens. Honestly, I'm not sure what you really do for treatment of that, because, aside from topical antiperspirants, there's not much you can do for that.
So a miswiring effectively is the theory, but not a dangerous miswiring, right? This isn't something to be concerned about, just very uncomfortable.
It's very uncomfortable. It's annoying, and it can be embarrassing. And so I think the people that do have this definitely usually try to get this treated, or they don't eat with people, which is kind of sad because eating is a very social thing in most societies. And, so I think if you ever run across somebody that has that, they should definitely seek help, because, it could be really easily treated with topical antiperspirants.
Great. Yeah. So this next question really hits home for, I think, a lot of people. And especially me, growing up, it's one of the reasons Casper and I started Carpe and wanted to work on sweat, is just social situations and not being able to just have dry hands when you go and meet someone new or go in for an interview. So the exact question is, whenever I get even the slightest bit of anxiety, interview, a meeting, etc., I start to profusely sweat on my forehead and upper lip area. It's so embarrassing and makes me feel the person across from me is questioning what I'm saying, making the anxiety and sweat even worse, compounding the problem. Is this considered hyperhidrosis?
Listen, any type of sweating that affects your life or your emotional state is considered hyperhidrosis, right? It's not defined as some quantity of how much sweat there is. It's really defined by how it affects your life. And so if it's the sweating is affecting your life in a negative way, then it is hyperhidrosis. And the great thing is you have a lot of treatment options. So you should definitely try to pursue those treatment options and figure out what's going to be the best for your particular condition. So especially like that, right? Like, look, everybody has some anxiousness, right? First date, interview, anxiety, and it's a little baseline anxiety and nerves is normal. But when the result is sweating, which drives this cycle of getting more anxious and more uncomfortable to the point where you can't function or you're not performing at your best, that needs to be addressed. And it should, nobody should have to suffer with that. If you're a little nervous, that's probably a good thing, in an interview and situations, but it shouldn't be to the point where, you're embarrassed. And so it's so nice that there are so many options available nowadays.
It's just what we hear a lot. And from our experience, it's just the last thing you want to have to worry about, right?
Yeah,
you're going for an interview, you're going on a date. It is literally having sweaty hands, having sweaty anything. Last thing you want to, and last thing you should have to worry about.
Yeah, absolutely.
Yes.
Absolutely.
So I wanted to tie back to something you mentioned earlier when we had the viewer question about, how bad can sweating get? Is it normal to have very sweaty hands? And you were talking about some patients coming in and the sweat's literally pouring out of their hands. This is something that we've had challenges with at Carpe sometimes, where if your sweating never really calms down to where you can apply a topical antiperspirant, it's very hard to get it on there because it's going to get washed out of the sweat glands before it gets in. I was wondering, in your professional experience, how often do you see that? And are antiperspirants really the only treatment modality that, is challenged by sweating that just can't stop for a second? Or have you, how does it affect other treatments like Botox?
Yeah, so really, antiperspirants are the main, modality of treating sweating that's really affected by it, right? Because if the eccrine duct is constantly pouring out sweat and you can't have good contact with the topical antiperspirant and those ducts, then you're not going to be able to stop the sweating. It's not going to be able to do the job it's there to do. And so, we have a lot of little tricks that we use for people, like, if, and a lot of it based on their trigger, right? So if heat causes a lot of sweating for them, we ask them to go in a cool room or a cool environment, or even put ice on the back of their neck, or some people chew ice and some of their sweating goes down. So not chew, but actually like kind of stick it between your cheek and teeth. And that actually cools down some of the receptors in the body and lowers your body temperature to the point where sometimes sweating stops. But that's only in certain people. And other patients, what we'll have them do is sit in front of a fan, because if they have a cool fan blowing, a lot of times that may stop some of their sweating, or at least help it evaporate to the point where you can get good contact. But if you can't get good contact because of constant sweating, you might have to pursue some of the other options. So for instance, Botox, you can it's actually injected into the skin, right? So it's able to penetrate and actually stop that signal from going from the nerve to the eccrine gland. And that's exactly what we want. We want that signal cut off, and that's not affected by constant sweating. And so, if somebody's got that problem where they just can't apply it because they can't stop the sweating, sometimes you can break the cycle using something like Botox. And Botox is expensive, right? It's not a cheap treatment. It's every 4 to 6 months you have to come in, get these injections in your palms and soles, and it's not comfortable. In the armpits, it's actually not too bad, but in the hands and feet, it's really uncomfortable. But what you may want to encourage those people to do is to go in and get the injections But then before they wear off, start using the topical antiperspirant like Carpe, and be consistent about using it, right? Because you want to, it's not how often you apply. You should apply it twice a day, but it's the fact that you consistently apply it over time, because then those little ducts keep blocked, right? So you can stop the sweating using the Botox. And then, after the first month of Botox, you start using the Carpe, and you block those ducts and you keep them blocked as the Botox wears off, and you should be able to maintain your efficacy indefinitely if you're consistent about using it.
That's, I think that's an excellent strategy.
Real quick, your point about putting hands in front of a fan
You hear that?
brought me back to high school, just driving on my way to a date, had the aircon at full blast, and just hands right in front of the
vents,
yeah.
in front of the vents in the car. I know that feeling.
So did it work for you? Did it actually help?
Well,
For like 2 seconds,
yeah.
Temporarily, right? So.
Temporarily is what you need sometimes, yeah. And I do even hear sometimes certain reviewers of Carpe saying that that's the trick for them, is a fan before they apply Carpe.
Mm-hmm.
I mean, Botox before they apply Carpe, like you suggested, might be an even longer term solution.
Yeah.
But speaking of that, Botox injections, particularly Botox injections for excessive sweating and very sensitive areas like the palms, a lot of people have trouble tolerating the pain, and that's like a big issue for them. What are some kind of tricks or hacks that you found that help people get through the pain of those Botox injections?
Yeah, so it's interesting because we actually did the clinical studies on Botox and Palmer hyperhidrosis, and the biggest part of getting that study done was figuring out how to manage the pain, right? So the 2 tricks that we use, one is, well, first of all, the skin's really thick there, so topical numbing medicines don't work. That wasn't helpful at all. But the 2 of the things that did actually work while we're doing the injections, I still use these tricks today, is ice. So we'll ice the hands, and then right where we're injecting, we keep the ice cube. We kind of actually put the ice cube down, move it, inject, move, inject. And so the area stays really ice cold, and you kind of almost have the pain from that ice being applied, and that distracts from the pain of the injection. Doesn't make it go away, doesn't make it 100% tolerable, but makes it better. The other thing, interestingly, that worked really well and has been proven to work is a vibrator. So you actually take a vibrator and you apply it, because pain and vibration are actually carried by the same nerve fiber, or C fiber nerve.
Yeah.
And so if you have vibration going on in that area, it actually prevents the pain transmission from going down the same nerve, and so, or distracts from it. And so that's been found to be really effective, is just using a vibrator and moving it along near where you're injecting. And if you think about it, like, it's a trick we've been using a long time, like when I do facial injections, or when a dentist injects you, a lot of times they'll like wiggle your cheek while they're injecting, right? And that's why they're wiggling. It's not because they have a tremor. It's because trying to, distract your nerve, your pain nerve, from actually picking up that signal. So those are the 2 tricks we use a lot.
That makes sense. So the key to a pain-free Botox injection is a vibrator made of ice. That would be ideal.
I'd like you guys to just work on that for me.
I think I'd be on the product development roadmap. That's excellent.
Awesome. So we have 2 more questions left from people. Second to last one is asking about irritation. So the question is, why do some antiperspirants result in itching?
Yeah. So, like I said, almost all antiperspirants are salts of some kind. And so when you apply a salt to the hand, it might be just irritating. So you can get what's called an irritant dermatitis from it. And everybody's different. Everybody has different sensitivities to different materials. And so, if there's a particular antiperspirant that causes irritation, you should just stop using it and then try a different one, because there's so many options available now, and find one that's non-irritating for you. The other thing is that they can all be a little bit drying to the skin, which could also cause irritation. Third issue is that you can also have an inactive ingredients, because some of them have fragrances, some of them have other materials, a lot of times like plant-based materials and things that are there, and you could get irritation from that. So it could be from the active ingredients, the inactive ingredients, or just the fact that the salt itself is an irritant. So, but luckily there's tons of options, and you can find one that works for you.
Great. That was really helpful. Thank you.
Mm-hmm.
And last but not least, final question for tonight. Is there a limit to how many times a day I should apply an antiperspirant?
Yeah. So really there's no limit. You can apply it as much as you want, but like we talked about before, I think it's the consistency that really helps, because we have to think about how topical antiperspirants work. And really you're trying to get that molecule into the little eccrine gland. So you need to have contact, right? So you have to apply it and let it be there for a certain amount of time. And once it gets in there and blocks the pore, you want to keep blocking that pore. And so it's really about consistency. So, for the Carpe products, it's twice a day. And if you're consistent about it, you're going to get much better results than you can't just use it episodically. And if anybody's ever tried even using, antiperspirant for your armpits, just over the counter stuff that you can buy anywhere, you can't just use it right before your date. It's not going to really do much. You really do have to use it for a few days in a row and use it consistently, and then you get the maximal effect. And then you want to maintain that maximal effect. You want to keep the dam blocked. And so you have to kind of keep applying a little bit over and over again to keep the little plug in place. So it's really not how often you apply it. Just apply it twice a day like you're directed to, but do it consistently.
Awesome. Well, yeah. Dr. Bhatia, this was a lot of fun and extremely educational. We cannot thank you enough. And I know the Carpe community, the sweat community, cannot thank you enough for so long. So many of us who sweated more than everyone else have just really felt alone. And one of the things that we're trying to do at Carpe is get the word out that, hey, if you sweat, no matter how much you sweat, no matter where you sweat, no matter when you sweat, we are here for you. And this, I think, was just a really awesome way to continue to build that community and build that support. And so we cannot thank you enough, and we cannot thank you enough for the impact that you're having on our lives and on everyone's lives out there who has sweat and is going to listen to this webinar. So thank you again.
Guys, you're too kind. Thanks for having me, and thanks for all you do, and thanks for creating the dialogue around this. I think it helps connect people, and I think there just needs to be a sense of community around here, because there's so many good things we can do to help people. It's just a matter of just getting that information out and together. So thanks for doing that.
Awesome. Thank you so much, Dr. Bhatia.
Have a great night. Thank you, everybody who came tonight, and we look forward to seeing you all soon.
Thanks for all the great questions. Good night.